Dental tartar can cause many health problems, including 1. Gingivitis. Tartar buildup can lead to inflammation of the gums, making them red, swollen, and bleeding easily. 2. Tooth decay. Tartar can accumulate around the teeth and lead to the erosion of the enamel layer, which increases the risk of tooth decay. 3. Bad breath. The buildup of tartar and bacteria can cause bad breath. 4. Gum disease. In severe cases, tartar can lead to advanced gum disease such as periodontitis, which may lead to tooth loss. After cleaning the tartar, it is best to follow the following instructions to ensure rapid healing and maintain oral health. 1. Avoid solid foods. For 24 hours after cleansing, avoid eating solid or hard foods to avoid irritation. 2. Use mouthwash. Use antibacterial mouthwash to reduce gum infections and bacteria. 3. Drink plenty of water. Water helps clean the mouth and keep it hydrated. 4. Avoid smoking. Smoking can delay healing and increase the risk of gum disease. 5. Gently brushing. Use a soft toothbrush and brush your teeth gently to avoid irritating the gums. 6. Follow up with the dentist. Visit the dentist regularly to monitor your condition and maintain the health of your teeth and gums.